group will have around 5 to 6 members, and you will have a mentor or a facilitator in your group. So there are 2 topics for today. We'll start with the serious health-related suffering. You have 50 minutes in small groups, 50, because there are 5 people, you will get 10 minutes each. So each participant can take 10 minutes to share with others in the group at how you're going to take the session on. It's just your ideas. You can use your slides or videos or workbooks or whatever you have been using or you're planning to use, or you can use the resources that has been shared through the drive. The mentors or the facilitators will be able to share their expertise in the same topic. Hope kind of clear to everyone, but if there is any doubt, any question regarding this, I can ask, because now we are going into small groups. We have exactly 50 minutes and we'll come back to the large group after 50 minutes. Am I audible to everyone? Oh,
Yes.
Thank you so much. So yes, 50 minutes, Dr. Annie. Means you have 5 participants in each group, 5 to 6. So each participant can take around 10 minutes to share their ideas or present their PPTs and get the feedback. Thank you so much. So we'll be seeing you in the small groups with the mentors. We'll keep sending reminders for the time because we have to stop in time today, not like yesterday. So we'll all leave you at sharp time today. Thank you so much. Thank you, everyone. We visited some of the groups. We saw wonderful presentations and discussions happening in many of the groups. Thank you so much for the interaction. So we are in the large group now. Is there any questions that needs to be addressed or discussed? We have 20 minutes for large group interaction. One person from each group can maybe summarize where you are and what you have gone through in the last 50 minutes. Group 1, would you like to, anyone from group 1, you can just summarize what you have been discussing in your group. And if there is any query, because we have all the mentors right now in this group now. So if there are any concerns or queries, please. Anyone from group 1? Dr. Anish and group, Dr. Rakesh, anyone?
Oh, no. So the Amala is group 1, yeah.
Yes. Dr. Rakesh, would you like to summarize what you have been discussing in the group? Or if there are any queries, you can ask, because we are all learning from each other. Yeah.
Dr. Lulu Madam was telling us to how to integrate this in first year students. We told it's difficult to convey the concept of this palliative care empathy into first year students. So take common examples such as from their neighborhood, from their family, patients who are chronic, who are bedridden, and share the experience with them and try to make them understand, because when coming to first year and first graduates, it is difficult to write them complicated cases scenario and also make it simple. Take the examples from their family, their close relatives, put an impact on them so they will understand better how to what this chronic patient means, so what are their problems, what they are suffering from, what all care they need from the society and from the medical field. So how to implement it in a simple way rather than making it complicated. Simple example, simple thing, and they try to convey the concept of palliative care to them from the beginning, and how to make teaching methods useful, such as PowerPoints, videos, and like that. Simple methods to make this idea convey to the first year students. That's what we are discussing in the first year group 1. Thank you.
Thank you, Dr. Rakesh. Was there any query that you needed to ask to the larger group? Anything that you wanted to ask from your group? You can ask that also. Or else we'll go to group 2. Group 2 who were with Dr. Aditi. Whoever was there with Dr. Aditi's group, please. I think this is a team from Geetam.
Yeah, yes, madam. I'm Dr. Ganesh, madam.
It's a good session, short group session, a small group session with Dr. Aditi Chaturvedi madam, and everyone has come there with their own views also, not only about the presentation, but also the healthy discussion that we had with mainly about the unmet needs and also the financial thing, which but I want to just to share with you the most important thing is that about the financial issue, madam. As India is a large population country, and so many only the pallium India is just like a baby coming out. So we should make it to large component, and educationally we should plan to have so many small groups, so that everybody should know about the pallium India, and the pallium India should go to the government thing, where the government will have the financial aid, so that it can come as we are discussing with Aditi madam, that non-governmental organizations, financial thing. So it should, government should put a word so to overall people, because it not only in urban, in rural parts of the people who needs more amount of palliative care. So it can be done with the help of a governmental setup. I request Dr. Rajagopal sir also, so that we grow and grow, so that the government can know about our aim and our thing, which should be gone across all of the India, not also next to the world also. So it is my pleading thing. I think it is it should be there, madam, in near future. It will happen. Thank you.
Thank you so much, sir. I think this program is exactly the good example, I must say, to integrate that in every aspect possible, so that we believe that through the young doctors, it will reach, at least they'll understand the concept as they go along with the medical education.
One good idea of the group was, Dr. Shri, I want to add, that they said that if we can make the undergraduate students visit a palliative care or a hospice, it will itself be of very educational importance, so that they get this value of caring for patients, palliative care patients, visit to a hospice or something, or a palliative care center. So that was a good idea which I found, that it will be a good education method for undergraduate students.
Yes, yes. Thank you, Dr. Aditi, for adding that. Group 3. Group 3 had Dr. Vineetha. So Dr. Vineetha's team would like to summarize or ask any questions or concerns if you have any, please.
Good afternoon, ma'am. I'm Dr. Kannan, and I come from I represent Group 3. So this is what we did. We spoke about what is palliative care is all about. And we also spoke about what are the importance of communication skills. We spoke about what is pain management is all about, and how the financial resources would be a burden for the patients, and how the financial resources can also be taken forward for the insurance companies and for the government agencies to understand. But these were topics which was presented by all of them from the group, which had either a PowerPoint, or they spoke out of their mind, or they spoke from a script. So which was audited, which was seen by Vineetha ma'am, and a lot of suggestions were given. So basically, when we are talking to the undergraduates, what we thought was, it was more like a very short presentation. Probably we should start with a sort of a set induction, nothing related to the topic, but which will capture the audience, and then we take it forward, and then we do something, and we break our entire talk into small capsules, like 5 minutes cutting, and whatever we need to talk, do it very less time. But more than that, we bring in real lifetime scenarios, ask them questions on that, and probably appreciate the students when they talk more, when they speak good about it. And we add a little more points to it. So which means that for any class scenario, work not more than 20 minutes or 25 minutes. So that was the gist which was discussed at various levels in our 45 minutes program.
Thank you so much, sir. Yeah, we have been looking into all rooms, and we have seen all these good discussions happening in those rooms. Thank you so much. And we got some idea about the PowerPoints in between. Thank you so much for summarizing it well for your group. Thank you. Dr. Vineetha, would you like to add something for the group? Can you unmute?
Yes. Yes, everybody came up with good work, and we did come up with suggestions like probably bringing in real life scenarios would bring the students more into the concept rather than, you know, concentrating more on the theoretical aspects of word to word of definitions and things like that. And the components also bringing it out from the students, looking at the scenario and asking them, what do you think is actually the main concern over here? So that is what we were trying to concentrate more on. And also about introducing the topic that is palliative care, again, a real life experience, and also starting off by saying that medicine is not just about you know, cure, it's a lot more other than that. So that was one of the plus points that our participants came up with. That was very nice.
Thank you so much. As Dr. Dinesh was also mentioning yesterday during his presentation, that when you ask the first year and second year students, he got wide variety of responses about the illness trajectory as well as palliative care or the elements of suffering than when he asked the final year or the interns, because these students are not yet exposed to the medical part of it. So they were coming up with a lot more ideas. And I think I heard from Dr. Lulu's group also that madam was suggesting you can just ask your neighbor or someone in your family who has been going through suffering, or at least take the newspaper and just see. Take one news, there'll be some kind of patient story or suffering related to it, and they'll be able to discuss on that, even though they cannot be with a real patient in the hospital. And these are all like workable things. You can just tell them to take the newspaper and just read it out and think about it. Thank you so much, everyone. And the next group, Dr. Mayank's group, I think from
Dr. Shri, I want to add one more point of our group.
Yes,
Dr.
please.
Ganesh pointed out very beautifully that all of us, when doctors will act as role models for our undergraduate students. When we will start giving up importance to our patients who are suffering from serious health related issues, from incurable diseases, when we will be sensitive to their needs, it will automatically be transferred to our undergraduate students. So we all have to be role models for our students, not only just give them a PowerPoint, but to be a role model. So that was very beautiful, which came out from Dr. Ganesh. That is what also I wanted to add.
Thank you, Dr. Aditi. Wonderful, wonderful feedback.
Sri,
Yes, sir.
before you go on to the rest of it, may I ask Dr. Lulu to give some more guidance for this session? She had a private chat with me and was making suggestion about how this common feedback session could move forward. Madam?
No, sir. I was just thinking, you should be talking about what they were all discussing, and each group would, I thought my thing was that, each group would come out with original ideas so that, that can be heard by the entire group, because those 6 in my room may have picked up only very little, but if they can get additional points. So one doctor was talking about Valium India, how to bring it up, that's not what is expected. You're all expected to do the work you have been ascribed to do. So I think that's the point here. Now, Sridevi has given each of you, pakka job function. So that should be executed and presented, and original ideas or new ideas presented here. That's all I meant.
So you continue. Thank you. Lulu, madam, thank you very much.
Thank you, ma'am. Thank you. Yeah, that's the whole idea of this large group discussion, so that we can exchange idea among the other groups, how you are going to teach this particular topic and what are the challenges that you might face. How are we going to overcome that as a team? That's the whole idea of this small group discussion outcome. Thank you, ma'am, for pointing it out. Next group, Dr. Mayank's group. I think it's the PIMS team, Pondicherry Institute of Medical Sciences team, with Dr. Adi. Anyone from that group? Dr. Adi, are you there? Would you like to share with the group how we were planning to conduct this session?
This is group 5.
Sir, you are in Dr. Mayank's group, right? With the Dr. Priyadarshini, Dr. Anil, Dr. Chitra.
Correct.
Yes, sir. Please, just to share with the other groups how you are planning to conduct these sessions.
No, our group, one person could not present. By the time, I think we didn't keep track of the time. Otherwise, group discussions went well. The usual points were discussed. And it will be better for Dr. Mayank to summarize and tell what the total group activity was, rather than me telling it.
No, Dr. Mayank, I think he had to go for an emergency procedure. He'll be back after the large group discussion.
Okay.
Maybe anyone else would like to summarize? That's also fine, Dr. Chitra.
No, I can say that.
Yes,
main points were, most of them were from the preventive and social medicine thing. So they had very nicely presented how to approach the students, how to do the role plays, how to give them a scenario, ask them to list out the what they understand, and then actually teach the class and come back to the same scenario and try to see if they are able to pick up the what is intended to be picked up, whether they've understood the different aspects of pain, different aspects of the financial sufferings what the patient undergo, and what is about total palliative care delivery, the barriers of palliative care as such. So those most of the points came up in the discussion were nice, and methods, each came up with a method of role play or a small video demonstration or asking the feedback from the students. And as others said, to take the students to the actual case, ask them to give the real life case scenarios, and also take them to the community so that they can actually see and feel what the different sufferings the patient undergo, apart from the physical pain, the social pain, the social isolation, the financial problems they face, the poor living conditions in which they live. These were some of the discussions we had.
Thank you, Dr. Chitra. Do you think it is possible to take them all into the community? Like you have already started doing something in your institution. So what do you think? Is it possible to?
No, it's not possible to take everyone to the community. Time is less. Transport is a problem. Maybe for electives, which is there for these batches, we can try. Or if they come as a part of an extra activity, we can do. But taking 150, 250 and all is not at all feasible.
So you were mentioning about, your group was mentioning about giving a case scenario and then show them some videos and then come back and then teach them what you mean by suffering, and then come back and see how you're going to. Is that what you were discussing?
Yeah, generally yes. And the financial costs also, the direct, the indirect, and then sensitizing the students as to looking at the whole way, because generally when they give a prescription, they are not aware how much it costs, whether family can afford and things like that. So on that points we had discussion.
That's wonderful. Maybe we can ask them to find out the price of these medications and come back.
Yeah.
And then they'll understand the financial.
That was like an activity we could give it to the students.
Activity, one of the activities. Not only medicines, also investigations, the cost of investigations and all that. So that they get an idea of how much money is being spent.
That's a wonderful idea, because then they'll actually understand how much it costs when they just prescribe for route thing. Thank you so much. And to the last group who were with Dr. Rajagopal, I think that's from, that's the group from Pondicherry, Dr. Shiv Kumar's team.
I think Dr. Nandakishore is ready to give some feedback.
Yes, sir, please.
Thank you, sir. So I moved into room 5 halfway through. I think I was shifted from another room, transplanted from room 1 to room 5 for time issues. So I actually, the content all the 4 groups have covered in depth. So I'm not going to go into the content. I'll focus more on the structure. So ours was more like a micro teaching session where Sir looked at how each person was presenting their topic, how engaging were they in terms of how the content was presented. Unfortunately, one could not present because of lack of time, and there was also a technical glitch in the initial part. My question to the larger group before I ask somebody else also to comment on the content is, could we maybe finish all the 5 presentations and then have a discussion so that people who are prepared don't feel left out, is one of the suggestions. That's one way we can do a micro teaching, where we do presentation 1, 2, 3, 4, 5, and then we have a feedback on what was okay and what was not okay. That's what, unless Dr. Karthik or somebody would like to add more on the content, any new ideas that came up, I'm done. Thank you.
Thank you. Karthika, you or anybody else, Dr. Hariharan, Fiba, anybody wants to add something? And my apologies to the person who was not able to make a presentation.
As Dr. Nandakishore said, we were doing more of a micro teaching session, how we would put across this topic to an undergraduate student at various degrees of learning. So teaching and assessment methods were mostly discussed in our groups. So I don't think we had much time to come up with new ideas, or we didn't have much of a discussion other than our topic, and sir was telling us ways to improve our how we relate to the students and how we can improve our communication to the students and get things across better.
Prasad is there, Pa? Isha, call him, no? Prasad.
Thank you, Dr. Karthika. Exactly as Dr. Nandakishore and Dr. Karthika mentioned, that is exactly what is expected out of the small group discussion. But I think there were some variations in some of the groups. This is exactly micro teaching activity where everyone should present. Meanwhile, people who are not really into palliative care can also understand the concept as well, and getting the feedback from the mentors. That's what exactly is expected. And I totally agree with Dr. Nandakishore. Maybe we can go on with the presentations, and then taking the feedback in the end would be something that we can practice from the next small group itself. Thank you so much. If there is...
Madam?
Yes, Dr. Arun, please.
If I may, actually, I would like to make a suggestion, because now we are going on a group-based discussion rather than a topic-based discussion. So we had 5 topics and 5 groups. So if you would have discussed each topic and taken input from all the groups, I think each topic, it would have been, we would do more justice to the topic if it was discussed on a topic basis rather than on a group basis. That's my personal suggestion, or my opinion. Right. For example, if we were discussing a topic of limitations of what do you say, financial burden, we could have discussed financial burden from each group if they had some input regarding that. So that way we will do more justice to the topic rather than just telling what we did in the group. That is what I would like to suggest.
Yeah.
I hope my point is clear.
Dr. Arun, I think you made your point very clear. I just was wondering, I was wondering whether that aligns with the objective of the program itself, where certainly we want to make sure that the right concepts of palliative care get taught. But I'd like to Sridevi to come in and say, in the group work, was the emphasis on the way it was taught, or on what it was taught, or was it equal importance to both?
So both, some of the people who were unclear, they called me yesterday and asked. To them, I told it's about the content as well as how you're going to teach the second year students.
Okay. Dr. Arun, I get your point. Thank you.
Thank you, sir.
Thank you. Thank you, everyone. We'll have a short break and see you all by 3:20 for the next group discussion on illness trajectories.
5 minutes break, huh?
Yes,
Okay.
sir. I have heard wonderful ideas in some of the groups. So I want you to share those ideas with the other groups as well, so that we can all get some good points. Group 1, Dr. Anish and others, you are with Dr. Aditi. Anyone from Dr. Aditi's group?
Yeah.
Dr. Anish, yes.
anyone
Dr.
else?
Nanda, yes, yes.
So yeah, we had a very fruitful discussion, and a lot of energy was visible throughout the discussion. Few important points that the group as a whole decided were worthy of presenting here was the idea that in sessions where we talk about the role of volunteers, bringing a real volunteer to the session and getting students to interact with a real volunteer and know the volunteer's story himself or herself would make a big impact. The second important point was that you could throw a question to students whether they would want to be volunteers to experience firsthand what the life of a volunteer would be like and what it involves. Also use the same as a tool to foster education about palliative care. And the third important point that we thought was to introduce palliative care as an elective subject. Okay, as an elective subject, because students are now offered 2 to 3 electives. It could be a fortnight or a little more than that, as an elective topic, a subject for students to explore. Anyone else from my group, if I've left out a point that needed to be added? Yes. Thank you.
One more point that I would add is, when we are giving the option of students to volunteer, Pallium India itself is doing volunteer training, and we could put forward this as an opportunity for MBBS students to become volunteers, because they may not know that they can also be volunteers. So after the interaction with the actual volunteer, they will be, I think they will be motivated, and an opportunity to get trained as a volunteer, because it's the initial inertia that works against being a volunteer. And that could be the first steps in a palliative care physician being born, even when he is a student. Thank you.
Thank you, Dr. Nanda and Dr. Anish, for those points. I think we all will definitely note this down, because these are going to help us, like bringing in a volunteer to take a session in a medical college is something really innovative, and it has its own impact. And as Dr. Anish mentioned, I would like to mention we have been interacting with a group of medical students called Medical Students Association of India, who have representations in every medical college. So they approached us that they wanted to get trained in some kind of sensitization in palliative care. So we did a 3 days training session, and one like quite surprisingly, I thought they just left it there. But then after a month, they came up with the presentations, and they are going to do their own awareness sessions in their colleges, in all the medical colleges that they represent. So we never expected that kind of response. We thought they just heard it and just left, like any other training program. But they approached us, they sent the PPTs and told us to vet the PPT. Can we go ahead with the program? We'll send you the feedback and evaluation, everything. And they want to train all the members in their association. They say they have representations in all the colleges. That's a very great idea, Dr. Anish. We should definitely take it up, to at least through them and these kind of associations. Students will be really encouraged to do it. Yeah. Thank you so much for that. Group 2, I think Dr. Vineetha's group. Anyone from Dr. Vineetha's group, Dr. Madhu and others?
Yes, madam. From Dr. Maila from Ganesh.
Please.
So, Rijju, madam, thanks for that nice healthy discussion in group 2. All of them have involved, and the topics which we are given, we have been enlightened not only about the presentation, but also Rijju madam has enlightened in detail about the things, points we missed in it. And it's a happy sharing with the madam also about the issues, about some points on field or ground field, about the students' involvement towards the patients in the on-field ground field, where they went to each individual how home they can go up and they can find out whether it's a family needs or the patient needs or the overall it's a financial needs, all the things. About the limitations of this palliative care, we discussed in briefly about the drug policy, about the drug this thing, and overall it's a good session. My teammates, if anything to be added, you please continue.
Is there anything anyone else want to add from group 2? Anything else that you have discussed? I think group 3, Dr. Mayank's group. Dr. Lilidambike, Dr. Annie, Dr. Jennifer, anyone from your group?
Ma'am, if Annie is there, she will share, ma'am. Otherwise, I will join, madam. Just give, I'll take 10 seconds.
Yes, sir. Please, please. Anyone from your group?
Yes, ma'am. We have been talking. Ma'am, we spoke about palliative care. So there were 2 good presentations were there, ma'am. And we were also talking about what are the financial implications of on palliative care. So the presentations by Lalitambike madam and one more of my colleague was all about palliative care. So only thing which we had was any presentations or anything which we have to discuss with the undergraduate students. What we realized was it will be great that if we have a lot more pictorial representations, a lot more real life situations and things like that. But then the financial implications on palliative care, as we are not exposed to that thing so much, though we have some real-time data with us. So what we had requested was if there can be a common template of how we can talk to the undergraduate students. Though we can bring in some scenarios, though we can put in some data and things like that, though we can talk about real life scenarios, some real template which can help all of us. This is something which we thought can happen. I think that is what I was telling Mayank sir also.
So you mean to come up with a template or on the financial implications of palliative care, right?
Yes, so that may be a, I personally felt, ma'am, because how much ever we talk, we can talk everything on palliative. We can talk so much on science and medicine and treatment and things like that. But when it comes to financial implications, it's a little away from our core. So it's a slightly difficult. We might lose something on the track because the reach out time for any student has to be only for 20 to 25 minutes of PowerPoint or discussion and things. So beyond that, it will be more of a one-to-one real-time discussion. And how do we do it? For for central institutes, it can be 100 students, but for private institutes, it's 250 students. So it's a large group teaching also. But that was what Dr. Annie was also suggesting. So there is something, though some of us are part of medical education unit, still medical education team and things like that, still it's a little, quite a big challenge for us. So.
Any of the mentors would like to take up that, any of the facilitators, experts in this group? Madam, Dr. Vineetha, Aditi, anyone would like to? Dr. Kannan was mentioning about the financial implications of palliative care and how that can be communicated effectively. Or any other group members, would you like to? Yeah, I think I'll have a discussion with about that topic, Dr. Kannan, and definitely get back to you on that. That's a very valid point that you have brought about. The next group, Dr. Rajagopal's group, Dr. Chitra and the team.
Yeah, this is Dr. Anil. So I'll be summarizing the things what we presented in our group. So everyone presented our given subtopics, but at the end of all the subtopics, we found out one common thing. The common thing is that we need to demonstrate as much as possible to the students for them to learn better. So what we got out of that, our discussion is that we have to keep the things very simple as much as possible. We have to, know what the student actually needs to know. So only then we might, do justice over there. And the topic, sensitizing the students on palliative care, as we discussed about that. Rajagopal sir actually mentioned, just sensitizing the students is not enough. Some action has to be, done out of that. So I would like to highlight that point. And then demonstration on real patients. This was the major discussion. So because most of the colleges, we don't have palliative care unit attached to our hospital. So how do we, show it? Because case scenarios, videos are always there, but seeing the real patient and having that real experience, makes a lot of difference. So that was the question. So how do we do that in most of the subtopics, whatever we were given? So one is sharing the experience. So the student, we can ask, as sir said, 1/3 of the population or 1/4 of the population definitely would have had, real life experiences that they can share. So that is one thing. Second thing is, visit to the old age homes. But again, taking them in large groups might not serve the purpose, because it might just be a tour around for the students. So it is the depth interaction what they're going to have with these, patients or old age person who is there. That is very important there. And see, you can take patients in your hospital also to see, the sufferings. But again, what happens there is, at the end of the discussion with the patient, what you're going to do for them, right? Just having the discussion and, finishing it there, it doesn't serve the purpose. So we should have some plans to have a follow-up, at least for a certain number of patients, so that, the students also feel happy, the patients are also happy, and you make a great attempt. So how do we do that? Again, some suggestions that came up is like, you have NSS units which have, funds, so you can use that. And you have, urban health training centers and rural health training centers attached with our college. So through that, actually, some patients can be benefited, and those experiences the students can come back and, for a large group they can, tell them, so that real experience is always there. So that was the summary out of our group discussion. Thank you.
Yeah, that's a wonderful point. I think I also overheard that conversation, that you demonstrate that there is a problem and then you don't do anything, and you're actually demonstrating to walk away from this problem. So it's very important to do something and demonstrate that also, so that the students, there is no point in just making them sensitize them about the health related suffering or illness trajectory or palliative care, but they should see how it is being done, and collaboration with the, I mean, there might be some NGO, some social service activists working in your sector, or at least, as you said, the rural or urban health centers that your institution might be taking up and collaborating with NSS. Or students, at some places, students themselves raise funds among, when they see all these things that happens in some colleges, that they raise micro donations, and then they like, I remember we all used to do that, the patient care services. We didn't know what to do, but then we started giving food or some other support to the patient. So those kind of unexplored areas can be explored. And if they start seeing that in the initial years of the medical education, I think it becomes easier later on when you talk about palliative care or suffering or being a humanistic doctor. I think that concept becomes clear when they start learning this much earlier. Thank you so much for sharing that, Dr. Anil. And that's a very good takeaway point, that just sensitization may not work, but we should see what is being done when you know that there is a suffering. That's a very good point. Thank you. Thank you, the group. And I think the last group, Dr. Lulu's group, Dr. Shivkumar, Dr. Ashwin, Feba, and Dr. Hari.
Sridevi, they had not understood what they were supposed to do. And only Feba had prepared a presentation, and that was really good. It was very good. How to sensitize the students on palliative, what can the students do in palliative care?
Dr. Feba, would you like to
One of
just
you,
give a gist of it, what you are planning to the group? You're still there?
Yes, ma'am. So I just gone about giving them, asking them, why do you think, what is your role? Why do you think, what do you think you can contribute to palliative care? And then putting a scenario, which was somewhat of a personal scenario for me. It was one of my neighbors who was young and diagnosed with terminal cancer. And I just put forward the scenario and asked the students, how would you address her, or your mother is asking you to speak to this person as a second year medical student, what would you say? So that is, and we discussed about, the importance, what skills they require to address this kind of issues and how they can go about it. And Lulu ma'am had said that it would be better if I had incorporated a role play in it. So if I would have, instead of asking them, what would you do in this scenario? If I would have called two students and said, okay, can you act out the scene and, do a role play, it would have stuck better with them. And yeah, I did use some of the resources that were sent in the mail also, so I don't take full credit for it myself, but thank you.
Thank you so much. And thank you so much, everyone. I understand some of the group members did not understand what they're supposed to do in the small groups. Kindly go through the resources that we have sent. It has a session plan and it has a lot of activities mentioned in that. It has PPTs, links to videos, and there is a trainer's guide. Trainer's guide mentions like what all things you use during the session. If you have opened it, it's very detailed. It may not be the ideal one. You may want to use some other technique, that is absolutely fine. But those resources has everything, including which year of medical education under which topic. They mentioned that in the CBME. How are we relating that? For example, trajectories of illnesses is mentioned in the internal medicine. I think the code is IM6 in CBME. So everything is mentioned in the resources that we have sent yesterday. So I hope by after today's exercise, it's a little bit more clear if I was not clear yesterday. So we have to come into small groups again tomorrow after one session, and then we'll be having micro. You may not be able to cover the entire subtopic that is given to you, but just give a gist of like what happened in many groups today. Just give a summary or a small micro teaching lectures to the other, thinking that they are in the second year of medical education and how you are going to teach them, pretend like making them as the second year students and getting feedback from them, what they felt could have been better, or taking feedback from the larger group also. If there is any doubt regarding tomorrow's schedule, just get back to me. Like many people called me yesterday, but so please or text me if there is any lack of clarity from my side. For tomorrow, we will be having a session on communication, and we're just showing the subtopics. So these are the subtopics that you have to choose from. We have given all the resources in the drive. There are two modules, module 1 on communication and module 2 on communication. There are PPTs, related videos, activities, assessment techniques, and the trainer's guide. Everything is there in the folder. And which year, under what context in CBME or 8Com it comes. So everything is written in detail. Just take a few minutes to go through that resources. You can use the same resources that is up. It's meant for to be circulated among yourself only. So that's absolutely fine. It belongs to you now, or you can come up with your own materials. So I'm happy to take any questions before we leave from today's session about tomorrow's plan.
Ma'am, could you please send the link through the email, ma'am, if possible, because from my phone I can open it, ma'am.
It's sent through email yesterday. All the
No, we haven't
Google
got,
Drive
we
link.
only got the link for the Zoom meeting today, but we haven't got
okay.
Google
Okay,
Drive
you mean the Zoom meeting link, right, sir?
No, ma'am, the drive, the resource link, ma'am.
That is sent as a link to your email. We'll just check. All the emails will be coming from tipsecho@palimindia.org. Just check your spam also. It's been sent yesterday. So if you have not received, just let us.
Your side also, I haven't got it.
Yeah, I'll just have a look at it. We'll just check whether it's been sent. Yeah, I think it's sent yesterday at 3:50. Just check in your spam also. It's a drive with all the resource for the upcoming session. So tomorrow we have Dr. Rijju delivering a session on communication. We'll start. Initially, we'll start with pain pathophysiology. We don't have any small groups for pain pathophysiology because Dr. Raj will be delivering a session. We don't have any small group teaching because we are not familiar with the pain pathophysiology. Communication skills, Dr. Rijju will be delivering one sample session for 40 minutes, and then we'll break out into the small groups and take the subtopics and take a micro teaching micro lecture in your small groups. I hope I'm clear. You can use a video. There are videos mentioned in that module. You can use that video and teach. You can use a PPT, or you can do role plays, whatever you feel is appropriate in your setting. So I hope kind of clear than yesterday.
Yeah, one question.
Yes, sir.
Am I supposed to select the one of subtopics and prepare in advance for tomorrow's?
Yes, sir. Yes.
Even
Yes,
before
sir.
I attend the communication.
Yes, sir. Yes,
Okay.
because communication, I think most institutes take communication skills for 8Com. Already, many of the institutes already, almost all the institute take communication skills for 8Com, and you can just go through the presentation and the material sent. You can just get it ready. And after the lecture, you feel that you should change the mode of teaching. I should use this than this. That's absolutely fine. It's all about just learning and understanding how we can deliver this at its best. That's all.
Thank you. Thank you.
Thank you, sir. Any other question from? Please feel free to text if you have any doubts regarding tomorrow's session. And apologies for, if not, there is some people did not understand what they were supposed to do, and sincere apologies from our side if they have not communicated it clearly. Thank you so much, everyone. So as promised, we have wind up today's session on time. See you tomorrow again with small groups on communication and a lecture on total pain and pathophysiology. Thank you so much. Thank you all. Bye.
Thank you.